My name is Matej Lekic. I'm a primary care physician at the Phoenix VA. Vaccine education and vaccine hesitancy with patients is part of my daily routine. It takes a team approach, and I work together with my nurses, Susan Nathaniel and Tani Roberts, to ensure this discussion occurs. Why do we vaccinate? To keep healthy people healthy, to prevent disease and death, to stop diseases from spreading, and to protect those who cannot protect themselves because of medical conditions. What's your process for asking about vaccines? I ask patients in an open-ended way about their views on vaccines. I try to understand concerns they may have that's preventing them from getting vaccinated. I spend most of my time discussing this with patients who are vaccine hesitant, meaning they're willing to engage in discussion and listen, but are feeling unsure. I explain how vaccines work and discuss common misconceptions. What are questions patients ask you? When I ask my patients how they think vaccines work, they frequently will tell me the vaccine will make me sick, then I'll have to fight off the infection. To combat these misconceptions, I emphasize that I'm not giving patients virus or bacteria that can make them sick. Most vaccines I give are not live, so I explain that they're only particles or remnants or protein and not whole microorganisms. For the rare live vaccines, I explain that the microorganism is very weak and cannot make you sick. It simply serves just to show your body the antigen it'll need to fight off. I describe it as a blueprint that your body takes in and then uses it to prime its fighter cells, your white blood cells. This way, your body is not overwhelmed or caught by surprise if you're exposed to infection in real life. Additionally, they may have concerns about the vaccine causing them to be infectious to their family. They'll get it and they'll spread it to their family. First, I say vaccines do not cause you to be infectious. In fact, if you get an infection from the environment, but are vaccinated, you're going to be less infectious, less likely to spread to your loved ones. Some will be dubious of needing the vaccine if they can still get sick. What's the point? It's not bulletproof. I can still get the infection. I'll explain that if they do get exposed to the infection, but are vaccinated, they may have no symptoms or less than they would have, as their body is able to fight off the infection immediately, instead of first having to develop the appropriate fighter cells. The body's not caught off guard. What about the COVID vaccine? For the COVID vaccine, the main question and concern I get is that it's a vaccine that interferes with your DNA, genes, genetic code. Patients will say, I don't want to get anything being incorporated into my DNA. I explain that it's an mRNA vaccine. I will review that we normally go from DNA to mRNA, then create proteins. The mRNA is just an instruction manual for your body to create a protein, which then becomes the antigen that you make memory cells to. No part of the vaccine actually stays in your body. It's just like a natural infection or traditional vaccines, your own immune system learning and memorizing what to protect you from. The DNA is not affected or changed, as this is downstream from the DNA process. Remember, DNA, mRNA, protein. What does your team do? My RN and my LPN discuss vaccines during their nursing appointments. My RN will review if patients are due for vaccines during phone calls, whether they be post-hospital or ER follow-ups, or whether they're coming in as a walk-in. My LPN asks about annual vaccines such as flu or COVID, even if they're coming in for a vaccination series. This is pertinent and ensures that we reach more veterans. In summary, not only are you protecting yourself, but you're protecting your loved ones and people you encounter every day. Vaccines are safe, effective, and save millions of lives every year. Our patients trust us. Give them a strong, confident recommendation for these vaccines. We're in this together.